Hey, you guys. Basically, this is just going to be me reading Kathy Park's flashcards because she doesn't have any YouTube videos for any of these. Thought it'd be helpful so we can listen to them when we're driving and stuff. So this is just trying it out, see if it's helpful or not. All right, so we'll start with the renal system because that's pretty short. So first we have nephrotic syndrome, which is a kidney disorder that causes massive loss of protein in the urine. Pathology, it's an immune disorder, a genetic defect, or inflammation causes an increase in glomerular permeability. Signs and symptoms: weight loss, frothy urine, that one's in red, anorexia, periorbital and generalized edema, that one's also in red. So for nephrotic syndrome, frothy urine, periorbital, and generalized edema. A little cool chicken hint: think of nephropathy syndrome to remind you that for nephrotic syndrome they have frothy urine. Labs: massive proteinuria greater than 2 plus, that one's in red, hypoalbuminemia, hyperlipidemia, and hemoconcentration. Diagnostics are ultrasound and renal biopsy. Treatment is corticosteroids, 25% albumin, and diuretics. And corticosteroids and 25% albumin are in red. Nursing care: monitor eyes and nose, daily weight, and abdominal girth. That one's also in red. Fluid restrictions: decreased sodium and moderate protein. Prevent skin breakdown and infection. All right, so next we have acute glomerulonephritis, AGN, which is inflammation of the glomeruli, often following a streptococcal infection, so strep throat. Pathology: antigen antibody complexes collect in the glomeruli, causing inflammation and decreased GFR, glomerular filtration rate. Risk factors: recent strep throat infection. Signs and symptoms: oliguria, brown, cola-colored urine, so like Coca-Cola colored urine. Signs and symptoms of hypovolemia, which are hypertension, dyspnea, crackles, and edema, so they can't get that fluid out of them, so they have hypervolemia. Labs and diagnostics. So for blood, you're going to have increased creatinine, increased BUN, increased white blood cells, and ESR, and a positive ASO titer. Urinalysis: hematuria and proteinuria. Increased urine-specific gravity. So for throat cultures, you might have a positive for group A beta hemolytic streptococcus. Treatments: antibiotics, diuretics, and antihypertensives, and corticosteroids. Nursing care: strict I's and O's, daily weight, decreased fluids, decreased sodium, and decreased protein. So that's all for acute glomerulonephritis. Next, we have acute kidney injury, AKI, which is the sudden loss of kidney function, which is usually reversible. So for patho, underlying causes include pre-renal, so that's decreased blood flow to the kidneys; intrarenal, direct damage to the kidneys; and post-renal, obstruction of urine outflow. So before the kidneys, in the kidneys, and after the kidneys can all cause acute kidney injury. Signs and symptoms: oliguria followed by diuresis and edema. So lots of pee followed by no pee and edema. Dysrhythmias from hyperkalemia, seizures from hyponatremia, tachypnea from metabolic acidosis, and hypertension. Labs: hyperkalemia, that one's in red; hyponatremia, also in red, so that's dilutional hyponatremia, they're peeing it all out; hypocalcemia, metabolic acidosis, anemia, and an increase in BUN and creatinine. Diagnosis through non-contrast CT treatments. You treat the underlying cause, diuretics, antihypertensives, and medications to decrease potassium level. That's in red. So it sounds like hyperkalemia is a big problem with AKI, and dialysis, of course. Nursing care, Caesar precautions, monitor eyes and nose, daily weight, diet low in potassium, diet low in sodium, also low in phosphorus, and low in magnesium. Okay, so next we have chronic renal failure, which is the gradual, irreversible loss of kidney function. Pathology, chronic and sustained nephropathy leading to kidney fibrosis and destruction. Risk factors, urinary tract malformations, reflux with frequent UTIs, chronic pyelonephritis, or glomerulonephritis. Signs and symptoms, decreased appetite, headache, nausea, vomiting, edema, hypertension, uremic frost, which is crystallized urea deposits on the skin. It's kind of gross. Pruritus, and increased bruising. Labs and diagnostics, you'll have an increase in creatinine, increase in BUN, increase in potassium, and increase in phosphorus. That one's in red for chronic renal failure. Decreased sodium, decreased calcium, and decrease of H&H. Treatments are diuretics, EPO, phosphorus binding agents, antihypertensives, calcium, vitamin D, dialysis, and renal transplant. Nursing care, monitor eyes and nose, daily weights, and the rest of these are in red. Limit fluid, limit sodium, limit potassium, limit phosphorus, and limit protein intake. So that's all for chronic renal failure. And next we have hemolytic uremic syndrome. Hemolytic uremic syndrome, which is a disorder caused by thrombocytopenia, acute renal impairment, and hemolytic anemia. So I think all three of those you have to have. Pathology, it's a toxin produced by E. coli, causes destruction of the RBCs and damage to the blood vessels in the kidney. Risk factors, ingestion of improperly prepared raw foods, recent illness, for example, gastroenteritis. Signs and symptoms, abdominal pain, bruising or abdominal bleeding, bruising or abnormal bleeding, fever, nausea, vomiting, and bloody diarrhea. That one's in red. Labs and treatments, anemia, so a decrease of H&H, thrombocytopenia, decrease in platelets, increase in creatinine, hematuria, and proteinuria. Treatment, IV fluids, packed red blood cells for anemia, plasmapheresis, dialysis, and in terms of family teaching, you want to thoroughly cook all foods, right, to avoid gastroenteritis. So that's hemolytic uremic syndrome. All right, next we have vesicouretal reflux. Vesicouretal reflux, which is backflow of the urine from the urinary bladder into the ureters. So the pathology is anatomic abnormality in the ureter, urethra, or bladder neck, or nerve damage allows for urinary backflow. So basically that little valve that goes from the ureter into the bladder isn't working, and pee goes back up there. Common cause of UTIs and pyelonephritis, which is a kidney infection. Signs and symptoms, dysuria, frequent UTIs, high fever, vomiting, and chills with pyelonephritis. Diagnosis, avoiding cystourethrogram, treatment, continuous low-dose antibiotic prophylaxis, surgical correction of the anatomic abnormality. In terms of family teaching, urine cultures every 2 to 3 months and with any fever. That one's in red, with any fever. So that's vesico-ureteral reflux. Extrophy of the bladder. I hope I'm saying that right. Extrophy of the bladder. That's a congenital abnormality causing the infant's bladder to be inside out and exposed. Pathology caused by malformation of abdominal wall in utero. Risk factors are being of the male sex, signs and symptoms, exposed bladder with continuous urine leakage, epispadiasis, undescended testicles, and inguinal hernia. Diagnosis through clinical assessment, treatment, series of surgeries which will require bed-bound immobility of the patient for several weeks, which points to one of the nursing care things, which is pressure injury prophylaxis, and that's in red. So nursing care pre-op apply sterile, non-adherent dressings over the exposed bladder, so sterile. Post-op, keep patient calm, provide analgesia, and decrease crying. And you're going to want to monitor eyes and nose. UTI, infection in any part of the urinary tract. Pathology, contamination of the periurethral area with bacteria results in colonization of the urethra and urinary bladder. Pretty self-explanatory. Risk factors, female sex, uncircumcised males, urinary stasis, vesico-ureteral reflux, and anatomic abnormalities. Signs and symptoms, poor feeding, vomiting, urinary frequency, painful urination, malodorous urine. Labs, urine positive for bacteria, positive for white blood cells, positive for blood, and leukocyte esterase. Okay, that one's in red. Leukocyte esterase and nitrates. That's also in red. Diagnosis through urinalysis and catheterization might be necessary. Treatment, antibiotics, surgery to correct the anatomic abnormalities. Complications that can arise, pyelonephritis, so infection of the kidneys, and urosepsis. All right. So for prevention of UTIs, for females, wipe front to back. Uncircumcised males, clean under the foreskin. Wear cotton underwear and avoid tight clothing. Avoid bubble baths. Empty bladder regularly. Avoid constipation by increasing fluid and fiber intake. All right, last card for renal system. Hypospadiasis and epispadias. I don't know if I'm saying those right, but hypospadias and epispadias, which is abnormal placement of the urethral meatus on the penis. So hypo is below and epi is above. Pathology is a congenital defect, unknown etiology. Risk factors, male sex, I have a penis, so obvious risk factor. Family history, signs and symptoms, urethral opening located on the ventral surface, which is hypospadias, or dorsal surface, which is epispadias. Diagnosis, clinical examination. Treatment, intervention is based on severity. Surgical reconstruction with possible stent may be indicated. And remember, for the surgical correction, they use the foreskin, or they might use the foreskin, so you're going to have to delay circumcision. Nursing care post-op, pain control, anticholinergics, for example, oxybutynin for bladder spasms, and catheter care. That's it for the renal system.